This course is for you if you experience acid reflux, also known as gastroesophageal reflux disease or heartburn. By the end of this course, you will learn what are the underlying causes of acid reflux, how you can manage your acid reflux with diet and lifestyle techniques, some of the top herbs that can help soothe acid reflux, and then some of my other favorite remedies. So let's get started with the course. In this part of the series, we are going to be talking about what are some of the symptoms of acid reflux, and then also what are some underlying causes. So let's go through some of the typical symptoms of gastroesophageal reflux disease. So some of the typical symptoms that are associated with gastroesophageal reflux disease are having epigastric pain, so that's pain in the upper area of the abdomen, having a sour taste in the mouth, burping a lot after meals, indigestion and bloating, so that would be the sensation of feeling bloated and also feeling like you're having difficulty with digesting food, and having acid regurgitation. So that could be food actually coming back up into the mouth, or even that burning sensation in the chest area. Some other symptoms that are associated with acid reflux that you might not typically think of are having a dry cough. So this is because the acid can be irritating the esophagus, and then sometimes you're left with having a dry cough, especially one that's worse at night. The sensation of something stuck in the throat or having to clear your throat often. These are both symptoms of acid reflux. And then lastly, chest pain. So now we don't always associate acid reflux with chest pain. A lot of the times people, if they experience chest pain, they think something's going on with the heart. Now that's something you would want to rule out to make sure there is no other underlying disease going on, but it can be a symptom of acid reflux. Now we're going to talk about what causes acid reflux. So in our digestive system, we have our stomach, and then we have the esophagus, and the esophagus connects right into the stomach. There is an area between where the esophagus ends and the stomach starts, and that's called the esophageal sphincter. Basically, what happens is the sphincter should open and close and allow food to go from the esophagus into the stomach. Now, if this lower esophageal sphincter is too relaxed, that might cause the contents of the stomach to go back up into the esophagus, and then you're experiencing that acid reflux. Another cause could be low stomach acid production. Now hear me out, because this might sound a little bit strange. You might think, well, if I have a lot of acid reflux, doesn't that mean that I have more stomach acid? Now that could be the case. You could have an overproduction of stomach acid, but typically what is seen in acid reflux patients is that there's an underproduction of stomach acid. So let's talk about this a little bit more. So when you eat your food, it passes from your esophagus into your stomach, as we mentioned. And then you need to have optimal stomach acid in order to break down that food and help digest it. If you have lower levels of stomach acid and you're not able to digest your food properly, that food is left hanging around in the stomach longer than it should and can irritate the lower esophageal sphincter that we mentioned and cause some acid reflux. Some other causes of acid reflux could be coffee, alcohol, and smoking tobacco. And one final point on this topic is that acid reflux could be a symptom of other gastrointestinal diseases going on. So some underlying conditions are a stomach ulcer, hiatal hernia, gastritis, which is inflammation of the stomach, H. pylori disease, and also gallstones. Now that we talked about some of the symptoms of gastroesophageal reflux disease and some of the underlying causes, let's move on to talk about testing. So typically acid reflux disease is diagnosed based on signs and symptoms. So some of those symptoms that we mentioned. And then also ruling out other causes of acid reflux, like some of those conditions that I had mentioned. So one form of imaging that's done can be an endoscopy. So that's a procedure where you put under anesthetic, and a little camera is used to go through your mouth into the esophagus and to view the esophagus and the stomach. This is a more invasive way of testing, but it can determine if there is inflammation in the esophagus and the stomach. It can determine if there's H. pylori disease. It can see if there is a hiatal hernia, and it can determine if there's more serious cause of disease like an ulcer or cancer. There's also the H. pylori breath test that can be done if there's suspicion of H. pylori disease. And that is basically a bacterial overgrowth that happens in the stomach and causes some symptoms like acid reflux, bloating, and pain.